Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner and nurse educator. Today I will be going over 5 fundamentals or foundations NCLEX questions courtesy of nursing.com. Nursing.com has thousands of NCLEX style questions. They have a SimCLEX, which is adaptive like the NCLEX. They have study plans, cheat sheets. They have videos, educational videos, to help support you throughout nursing school. They're not just an NCLEX review site, but they help you throughout nursing school. If you're interested in checking them out, check out my affiliate link in the description below. The surgeon working with the nurse has asked the client to be placed in the right lateral position. The nurse knows that which of the following positioning techniques can apply to this request. Pillows may be placed between knees. Client will be side lying. Lateral is on your side. An axillary roll will be used for positioning, and the client will be right side down. This was a hard question. 28% answered this correctly. I will put an image of what a right lateral position looks like, but lateral does mean on your side. And an axillary roll will be used for positioning. The client will be on the right side. That was said right in the question. And the pillows may be placed between the patient for padding. So the other wonderful thing about nursing.com is when you miss a question, it's linked to a video so you can see what you missed and cover that topic more in depth. A client presents to the emergency department with a foreign object sticking out of the left eye. Which of the following is a priority intervention? Select all that apply. Begin a bowel regimen protocol? No. Prepare the client for X-ray or CT scan of the eye. Make the client NPO, perhaps, if they need surgery. Administer IV antibiotics and carefully remove the foreign object. I would say that the physician should be doing that, not the nurse. So keep in mind when you're answering these questions, you are answering this from the point of view of the nurse. You're not the physician who's doing it, even though in your mind you may say like, yeah, of course we need to remove this object, but you're answering from the point of view of a nurse. So administering IV antibiotics, this is a medical emergency. An ophthalmologist should be consulted. Make the client NPO in case surgery is a possibility. Imaging will be needed to see how deeply this is lodged. You're not removing it. The ophthalmologist is going to be consulted and will determine the appropriate action. This was a medium difficulty question. 41% answered this correctly. It's also nice that they do this because you can see kind of where you stand with your peers. Question 3. The nurse is having a conversation with the client who is scheduled to start their 3rd round of chemotherapy. The client states, I do not want to do this. My spouse is forcing me. The nurse knows that which of the following components of informed consent is being broken. Informed consent must be voluntary. So this was asking about what was broken, and the decision must be voluntary, and in this instance the client is stating they're being forced. A client is complaining of pain in the epigastric area. The nurse knows that the pain is in which location in relation to the stomach. I will put a picture here of the epigastric area, right above the stomach. So epi means above. And the 5th question, a nurse has taken over a new position as manager of a clinical health unit. The nurse wants to foster team building with the staff nurses on the unit. Which activities would the nurse employ that would promote teamwork for this group? Select all that apply. Ensure that tasks are evenly distributed. That does seem to foster team building. Encourage active participation. Understand that responsibility affects the entire group. I do have a course on test taking strategy that just teaches you how to analyze a question and answer and select answers. So it's not an NCLEX review course, it's a test taking strategies course. If you are interested, it's in the description below. But encourage has a positive connotation to it. I'm not, you still need to read the question, but when you see answers like encourage, promote, those are usually positive connotation words that will point to a correct answer. So you can pause to read the rationale. But of course, we want work to be distributed evenly so that others don't resent others, right? How many people have done group projects and it seems like one person does all the work? Make sure that you smash that like button. Make sure that you subscribe. turn on the notification bells. I appreciate it tremendously. It helps other students find my channel that are struggling with the NCLEX or nursing tests. And please help join the challenge. I'm trying to reach 30,000 subscribers by the end of September. Thank you.